Welcome to today's call. Today we're going to cover the health benefits of extra virgin olive oil. And you're about to see that this is one of the most inexpensive and easiest strategies you can add to your life to decrease your risk of cardiovascular disease, cancer, and immune-mediated inflammatory diseases, as well as non-alcoholic fatty liver. So before we get started, I want to say, like we always do, that this calls for informational purposes only. Before instituting anything that you learn on this call, speak with your primary care provider because they know your unique case. And for some of you out there, adding more extra virgin olive oil to your diet or your lifestyle may not be what you need physiologically. So speak with a provider who's working with you one-on-one and knows your case. Also, we do our best to make sure this information is current up to the date of this call. If you're watching this after the call at a future date, this information could be out of date at that point. So make sure you're getting up-to-date knowledge on this. And lastly, we'll do our best to make things as accurate as possible, but we don't guarantee the accuracy of the information shared today. So let's get started. Extra virgin olive oil. Why is it good? Why would you want to add it to your life? What is so important about it? Well, for years, science has been studying the effects of what's called the Mediterranean diet. And the Mediterranean diet is up there with other ancestral type diets like the paleo diet, in that many of the people who practice the Mediterranean diet or the paleo diet show much greater health and much lower risk profiles for chronic diseases than people who consume the Western diet or the standard American diet. So specific to the Mediterranean diet, why is it called the Mediterranean diet? What makes the Mediterranean area of the world so special? Olives and olive oil is the answer. Extra virgin olive oil specifically. So what you need to know when you're at the store is you have options, right? You can purchase extra virgin olive oil or you can purchase refined olive oil. What's the difference? Well, there's a huge difference, so you need to know. Refined olive oil is exactly what it says. It's refined. It's adulterated, so to speak, by man, whereas extra virgin olive oil is as close to nature as possible. So it's cold pressed. The olive oil is cold pressed and removed from the olives to prevent rancidity of the oil, to prevent too much heating, which then would turn it into a trans fat and render it worthless. So it keeps the oil in the state that nature intended. It preserves the polyphenols and all the nutrients in the oil that we're after. The refined olive oil does not do that. So by refining it through the man-made process of refining the olive oil, you lose the nutrients we're after, the polyphenols and the anti-inflammatory compounds and antioxidants that we desire. So when you're purchasing olive oil, you want the EVOO, the extra virgin olive oil, not the refined. Where you might get caught is it may not say refined olive oil, it may say virgin olive oil. That's still refined olive oil. Unless it says extra virgin olive oil, it's not extra virgin olive oil. So make sure you're buying the EVOO. Okay. So for years, they've been studying the Mediterranean diet, and they've been studying it in relation to cardiovascular health, in relation to cancer risk, in relation to fatty liver risk, in relation to immune-mediated inflammatory diseases like autoimmune disease, like multiple sclerosis, etc. And what they find every time is that olive oil is very useful. So I want to start with cardiovascular health because that's the #1 killer in the US. Many people deal with cardiovascular disease, and the risk factors in this study that were studied were smokers, people with hypertension or high blood pressure, people with dyslipidemia or cholesterol issues, like high cholesterol, high LDL, low good cholesterol or HDL. Remember, there's no good or bad cholesterol. They're all essential. They're good or bad if the ratios get skewed or they're out of whack. if you're overweight and obese, and then family history of cardiovascular disease. So these were people 55 and older with these risk factors, 3 or more. And they may have had type 2 diabetes, which many of these risk factors are part of. So what did this study find? After subjecting the study participants into random groups, one group got Mediterranean diet and extra virgin olive oil, one group got Mediterranean diet and nuts, one group got the controlled diet. And what they found was that the Mediterranean diet with extra virgin olive oil and with nuts had significant impacts from a positive perspective on cardiovascular disease, whereas the control diet, which was just a low-fat diet, did not. So what changed? The Mediterranean diet decreased blood pressure. It improved your cholesterol levels or your lipid profiles. It improved lipoprotein particles, which is more in-depth testing on your cholesterol profile to look at risk for atherosclerosis, clotting, heart disease, stroke. Mediterranean diet with extra virgin olive oil or nuts decreased inflammation, decreased oxidative stress or free radicals, and decreased carotid atherosclerosis. So risk of carotid clot, which could lead to stroke. And then lastly, they decreased the expression of genes that promote clotting. So extra virgin olive oil in this landmark study done almost 10 years ago showed big time benefit for cardiovascular disease. And studies even before this one have found the same. So let's start with the earlier one here. We have a study looking at atherosclerosis risk in mice fed a Western diet versus extra virgin olive oil. And what they found was that extra virgin olive oil induced a cholesterol poor apoprotein A IV enriched lipoparticle that has enhanced antioxidant activities, which is closely associated with reductions in atherosclerotic lesions. So that's nerd terms to say it changed the lipid profile, changed the cholesterol profile from a pro-heart disease in these mice to anti-heart disease in these mice. This study looked at the polyphenol-rich olive oils and wanted to compare that to risk of atherosclerosis and how does it impact lipoproteins. And again, what they found is that the polyphenols in the olive oil, which is what we're really after, provided benefits on lipoprotein particle ratios and subclasses. So extra virgin olive oil, if you look on the back label, you're going to see that it's 99 to 120 calories depending on the brand you buy, and basically it's all going to be zeros except for fat, which will show 12 to 14 grams of monounsaturated fat. And so if you grew up in America, you may hear, especially if you're female, you may see, oh, it's all fat, I don't want to eat that, because you're inundated with basically propaganda saying fat is bad. But really what's bad in the typical American diet is the carbs, is the sugar. The fats are good if they're good fats. And extra virgin olive oil, monounsaturated fat, is an excellent fat. So don't be driven away from that. So nearly 100% of extra virgin olive oil is monounsaturated fat, but what we're after is that 1 to 2%, which are polyphenols. And the polyphenols are what provide the anti-inflammatory aspect and the antioxidants and all the things we're about to get into. So that's why we want the extra virgin, not the refined. And that's what made the changes in the cholesterol lipid classes in this study. Let me jump over now to the internet and we'll share some more. So if you go on pubmed.gov, this is the Public Library of Science. You can search all the research going on any topic in the world. Just type in here what you're looking for and studies come up. But this study here done in 2019 looked at the Mediterranean diet with extra virgin olive oil and the associated risk of non-alcoholic fatty liver disease in older adults with a high risk of cardiovascular disease. And what they found was the diet with extra virgin olive oil was potently antioxidant and anti-inflammatory, and was associated with reduced prevalence of fatty liver in older adults with high cardiovascular risk. So if you are an elderly, older adult, so you can see in the study here, they were age 64 or older, at high cardiovascular risk. So 62% of these adults had type 2 diabetes. If you're an older adult with type 2 diabetes, you're at high risk for cardiovascular disease, but you're also at high risk for fatty liver. And so one way to reduce risk of fatty liver is to add extra virgin olive oil to your diet, or to switch to a Mediterranean diet overall. This study was another one looking at cardiovascular risk and specifically clotting. And what they found again was the Mediterranean diet. And when we say Mediterranean diet, we're basically saying extra virgin olive oil, because that's a huge part. That's where most of the fat in that diet comes from. It decreased inflammation, decreased risk of thrombosis or clotting. So if you're someone who has blood clotting issues, you may be on warfarin or Coumadin, but maybe adding extra virgin olive oil to your diet and your lifestyle could lower your dose that you require of that medication. Again, this is where you want to be specific with your primary care provider who's following you, who's testing your INR and making sure your blood is where they want it from a coagulation standpoint. So don't just add this in without telling your doctor. Speak to your doctor, set up a plan with him or her, and move forward that way. All right, let's jump over here. So we've been talking about extra virgin olive oil for cardiovascular disease. Here's a picture for you. This study here was in the journal Endocrine, Metabolic, and Immune Disorders. And again, extra virgin olive oil and cardiovascular disease benefits for human health. And in their picture here, that you can see the extra virgin olive oil inhibits or decreases hypertension, inhibits high cholesterol, inhibits oxidative stress or rusting, so to speak, inhibits diabetes, and inhibits inflammation. So whereas all of these things downstream promote inflammation and atherosclerosis and clotting and cardiovascular disease, the extra virgin olive oil is able to knock all those things down. So again, a key strategy in preventing cardiovascular disease. Now, if we want to look at this study is looking at immune-mediated inflammatory disorders. So does extra virgin olive oil, specifically the polyphenols, play a role in prevention and treatment of immune-mediated inflammatory diseases, such as rheumatoid arthritis, inflammatory bowel disease, multiple sclerosis, lupus, and psoriasis? So this graphic here is, if you see all these little lightning bolts, the lightning bolts are the polyphenols found in extra virgin olive oil. And these are where the authors found that they can have a role physiologically in these diseases. So the RA, the lupus, the MS, the inflammatory bowel disease, the psoriasis. So people watching this video have probably read plenty on the gut, probably partially understand at least how important the gut is to overall health. And one reason why leaky gut or gut dysfunction can lead to disease is this term called dysbiosis here. And dysbiosis basically means that the microbes that make up your microbiome in your gut, so the bacteria, the viruses, the yeast, the parasites, the worms, if that becomes imbalanced with your probiotics or your good bugs and your immune surveillance, that can lead to what's called dysbiosis and potentially Crohn's, ulcerative colitis, IBS, all kinds of things. So you can see here that the polyphenols play a role in the gut by modulating your microbiome. So extra virgin olive oil and the polyphenols in it promote an anti-inflammatory microbiome. It promotes species that provide anti-inflammatory benefit and are more aligned with what should be in a healthy human gut. So if you have an issue with dysbiosis, potentially extra virgin olive oil can play a role in improving that And by improving that, you can have upstream effects by impacting your psoriasis potentially through gut-skin axis, or your MS through gut-brain axis, or your RA through gut-joint axis, or your inflammatory bowel disease through gut-gut, right? So the gut impact can be huge from the polyphenols. The adipose tissue, we talked about fat, we talked about type 2 diabetes and cardiovascular disease and obesity. If you're changing the fatty acid profile in your body, if you're changing your fat tissue, you're changing your inflammatory levels. Fat cells are little endocrine factories. They produce these inflammatory cytokines listed here. So the more fat tissue you have, the higher your risk of systemic inflammation, the higher your risk of chronic disease. So again, if we can skew or balance your fatty acid profiles by adding good fats like monounsaturated fats, we can decrease your inflammation risk and decrease, therefore, your cardiovascular risk, your cancer risk, your immune-mediated inflammatory disease risk. Polyphenols improved antigen presentation. So antigen presenting cells are the cells that take damaged tissue or take a bacteria or a virus to your T and B cells and present it to say, hey, go kill this. And so the more efficient your antigen presentation, the better your immune system responds to infection and clears it. You can see up here the T cell subset differentiation is altered. So again, the polyphenols play a role in efficient maturation from immature T cells to the T cells that are needed in a given situation. Th1 would be needed in intracellular infection like viral or bacterial. Th2 would be needed to respond to anything mucosal, gut, lung, sinus, bladder, so allergies, things too big for our cells to eat, parasites, worms, candida. Th17 functions in the mucosal barriers as well. And you want to prevent Th17 from being too robust because that can promote the tissue damage and autoimmunity if it gets out of hand. And then we can promote T regulatory cell function, and Tregs are the ones that quiet everything down. Shh, don't be overinflamed. We've killed that virus. Let's put the fire out now. Or we've cleaned that tissue up. Let's put the fire out now. And then up here, this is showing on a genetic level that the polyphenols help promote anti-inflammatory factors, inflammatory mediators, and antioxidants and detoxifying enzymes. So again, we want to have optimal antioxidant defenses, optimal liver detoxification, optimal anti-inflammatory defenses. And it's not that we don't want any inflammation, it's just we want proper inflammation. So the polyphenols that make up the 1% to 2% of the extra virgin olive oil are what we're after here. And then lastly here, you can see stats. Stats are transcription agents in the genes, or in the nucleus of the cell, that promote production of different things. This study here shows that oleasin, which is one of the polyphenols in extra virgin olive oil, inhibits STAT3, activates the apoptotic machinery, and exerts an anti-metastatic effect on human neuroblastoma cells. So a neuroblastoma is a brain tumor. And this study looked at, could the oleasin polyphenol from extra virgin olive oil inhibit STAT3? STAT3 is a transcription agent that promotes Th17 cells, which again, if they get out of hand, can promote autoimmune disease, so we don't want that. So inhibiting that would inhibit or lower your risk for autoimmune disease. But STAT3 also plays a role in cancer, and so inhibiting that helps inhibit cancer. Activating apoptosis means we kill cancer cells. We don't let cells that shouldn't be there live. So it's kind of like setting off the self-destruct button for them. And then an anti-metastatic effect is, you've heard of metastasis. You may have known someone in your life that's had cancer and they beat it, so to speak, but then they find out later that it had metastasized or spread to the lung or the bone or whatever. So anti-metastatic effects means it's preventing the cancer from spreading. So if you have a breast cancer, let's keep it just there in the breast so we can focus on treatment there and not let it go to the rest of the body. Or in this case, it was in the brain, so we're preventing it from spreading there. So big time positive benefits from the Mediterranean diet and extra virgin olive oil specifically. If you are not currently eating enough good fats because you've been indoctrinated your whole life with the lines that fat is bad for you and you should avoid it at all costs, introducing extra virgin olive oil into your diet is one thing that could be very, very beneficial for you in a quick short term, in the short term and the long term. So first you want to speak with your practitioner about that. And the studies vary in terms of dosing, but some studies say the average Mediterranean diet contains up to 4 tablespoons of olive oil a day. So that may be an area that of dosing to aim for. But again, you want to first speak with your practitioner who knows you and knows your case, because on an individual level, right, or excuse me, on a population-wide level, would the U.S. benefit from adding extra virgin olive oil to their diet? Yes. But on an individual level, would some people be hurt by it? Probably. Who would those people be? Probably people who are on anticoagulant therapy or anti-clotting therapy, blood thinning therapy, warfarin, Coumadin, who now add a blood thinner, natural blood thinner like extra virgin olive oil, and now their INR gets skewed, and they may be at risk for bleeding too much if they're too blood thinned, so to speak, or too anticoagulant. So if you're someone that fits in that category, you need to speak with your practitioner, but all of you should speak with your practitioner first before adding it. And if you add it, after a certain amount of time, leave comments and let us know what you experienced. Did your blood pressure go down? Did your cholesterol levels change? Did your pain go down because inflammation went down? Did you have fatty liver and it's reversed some? So let us know once you speak with your doctor about how to best implement this. After you've implemented it for a time, let us know what you've experienced, and realize that, again, optimal health comes from optimal living, and an optimal lifestyle requires healthy nutrition. Healthy nutrition is not the standard American diet or the Western diet. Healthy nutrition is something similar to the Mediterranean diet, an ancestral type diet, and physical activity levels that are healthy, sleep that is healthy, water that is healthy, sun exposure that is healthy. So you know that I love doing this with people every single day. If you need a practitioner to work with, reach out and I'd be happy to partner with you and help you live a life at optimal.